Hello, and welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Carter Anderson, and in today's episode, we'll be getting to know one of Cass Health's new family medicine providers, Dr. Jill Pollpeter. Before we get started, two quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Welcome. Thanks for taking some time to chat with us today.
Thanks for having me.
Yeah, so we'll just kind of get started with, where are you from?
So I was born and raised in Omaha. I lived there for most of my life, went to undergrad there, went to medical school there at Creighton University. And then I spent the last 3 years in Des Moines doing my family practice residency through the Unity Point Health System, mostly at Iowa Lutheran Hospital.
Cool. So what type of patients do you care for?
I care for anyone and everyone. So anyone from newborn babies to patients in the nursing home and whatever comes in between.
Gotcha. Very cool. So kind of all ages and stages of life there.
Yep. All ages, all stages, all genders, whoever needs healthcare.
So what do you enjoy doing when you're not at work, when you're outside of the hospital?
Ooh, I'm a little bit of a homebody. My husband and I found a property just northwest of Griswold. So we've been doing a lot of yard work, and we have a dog and 7 chickens. So that takes a little bit of our time and energy as well.
That's very, very fun. Has there been any like big challenges that you've bought that new farmhouse and stuff, or has there been anything that you've got like, this big project that you're working with there?
Thankfully, the property was pretty well taken care of, so we don't have a lot of things we have to do, but we definitely have a lot of things we want to do.
Right. Not very many needs, but a lot of wants.
Oh, yeah. Yep.
Back to kind of going into your track and everything, what made you choose family medicine? Was there like a moment you're like, man, I want to care for all ages and all stages, or was there kind of that sounds like fun, I want to do that?
Yeah, I think that there just wasn't a whole lot that I wanted to rule out as I went through my medical training. I really enjoyed a little bit of everything. I like the variety. I actually lost my family medicine physician when I was in medical school. He passed away suddenly, and so that experience really showed me how important family medicine doctors are to their patients. And so I just love being that resource and kind of that constant in people's life.
So your personal primary care provider passed away while you were in residency, is that what you said?
When I was in medical school.
In medical school, excuse me, yeah. Wow. You said kind of that, how important that connection can be for people, right?
Yeah,
kind of a
absolutely.
first-hand experience.
I mean, I saw him at least once a year for the first 20-some years of my life.
Right, so wow, so you kind of had it was the same one for most of your life then? Wow.
Yep.
What made you choose Cass Health? What made you want to come work in this kind of rural healthcare system?
Yeah, so I had a recruiter reach out to me during residency, and she told me about this opportunity in Atlantic, Iowa, which I had never heard of before. And when I looked at it on a map, it actually was the perfect location for me and my husband. So being born and raised in Omaha, my mom still lives there. And then my husband's family, most of them are in Des Moines. So we're kind of smack dab in the middle, right between them. And as I learned more about the job, it just seemed like I could do a little bit of everything, which is what I wanted, but you're not on an island here. We have a lot of specialists. We have a lot of access for our patients. And so that was really important to me, especially coming out of training, this being my first, real job. I definitely wanted to make sure that I felt supported and had some specialists around, and also had some really great partners. And all the physicians and all the providers that I met through my interview process were just so great. So I felt like I would be supported here.
Awesome. That's super great to hear. Like you said, that great support system locally, and then being close to family and stuff like that too. Very, very cool. To those patients here at Cass Health, if you had a message that you could share with any of your future patients here, what would it be?
I just want my patients to sit in my exam room and just feel comfortable telling me whatever they need to tell me. I really try to be your partner. I don't tell you what to do, but I will give my guidance and my advice, and then we can kind of decide the plan together.
Love that. They get to be the partner in the care, right? That's not just like, I'm going to tell you what to do. They kind of get that choice, and you help them make the choice that's best for them.
Absolutely. Everyone, is their own individual person, and all of medicine is based off of studies and statistics. But at the end of the day, you're your own person, and I can tell you, what the consensus is, but that might not be right for you. And I'm okay with that, and I'll support you in that.
Awesome. Some more fun questions here for you. Do you have a favorite sports team?
You know, my husband does not like watching sports with me because I'm really bad at picking a team. I'm the person that like cheers for a good play no matter who makes it. So I don't really have a favorite team, but I'm all for, you know, a good play any day.
It sounds like you need one of the shirts that I think the Atlantic High School came out with this year. It just says, "Go sports."
Yes,
win
absolutely.
the game, score the points, or whatever.
Yes. Yes. Love it.
Yeah, those are great. Do you have any, I think you mentioned it already, some pets at home?
Yep. So I have a dog. And then if you count them as pets, I have 7 chickens right now.
Are they layers or are they like broilers?
We have 6 layers, 6 hens, and then we have 1 rooster.
Does he wake everybody up nice and early in the morning like a prototypical rooster? Or
He's
not really?
actually pretty quiet. You know, we can't even really hear him from inside the house. I haven't asked our neighbors. I hope that he doesn't bother them. But they have cows, and their cows are way louder than our rooster.
I was going to say, those dang cows early in the morning, they're nice and loud too.
Oh,
so.
yeah. Oh, yeah. But he's young, so maybe as he gets older, you know, he'll get a little bit more brave and have a little bit more oomph to his crow.
Right. Come into himself a little bit. If you're cooking dinner to impress, what are we making?
Ooh. Probably enchiladas or lasagna are kind of my like tried and trues, but I like to, you know, mix it up and try new things. I think that I've been exploring the world of sourdough recently. It's harder than it seems. Some stuff has turned out good, some stuff not so much. But then the chickens get to eat it, so everyone's happy.
The chickens benefit, and then what's your favorite thing that you've made from sourdough? Have you made like any like...
Just like a basic like sandwich loaf is probably my favorite thing. It's a little bit less tricky than like the pretty artisanal loaves. But yeah, it's been good so far.
That's what I wasn't sure if you delved into any of the fancier stuff, because I know that sourdough stuff, you can go a million different ways with it, right? Kind of making whatever you want.
Oh yeah. It kind of takes a whole day that you have to really like baby it though. So I haven't done a whole lot of artisanal loaves. I'm kind of, more practical in my approach.
Right, there you go. You got to be able to make some good sandwiches with that stuff.
Absolutely.
We will never catch you doing what?
I feel like that's such a hard question. I will try almost anything, but I mean, dang, that's a hard one. I really, even looking at that question previously, didn't really have a good answer to it. I guess I am just not a reader. It's something that I really wish that I was. I wish I enjoyed sitting down and diving into a good book, but that's just never been me. So I guess you'll never really catch me reading.
There you go. Not reading. Reading for fun, at least, right? For
yes.
leisure. There you go.
Yes. And when I do read, it's much more likely to be like a nonfiction, like biography or something like that.
What's your favorite holiday?
I would have to say Christmas. I know it's kind of like, I feel like everyone's answer, but that's because it's the best. So like, I mean, I feel like no one's going to argue with that.
Right. We've done quite a few of these, and that answer varies way more wildly than you would expect.
Really?
Yeah, a lot of people will say Thanksgiving. We've had some 4th of July. There's been a bunch of different ones, actually. So, yeah.
Well, then not everyone says Christmas. I feel like as a Nebraskan, kind of being an outsider, I should say Arbor Day, but, you know, it's not really anyone's favorite holiday.
I was going to say, is it everyone in Nebraska's favorite holiday, too, or not really?
No one cares.
When is Arbor Day? Is it in April? Uh-oh, she doesn't even know what day it is.
No.
Fake fan.
I feel like it's in September even. Oh my God, that's so embarrassing. I don't even know. Wow, I'm such a bad Nebraskan.
What's your opinion on runzas while you're looking that up as a Nebraskan?
Oh, I love a good runza. I really do.
You're driving alone in the car. What are we jamming out to?
So I'm a strong believer that music preference is seasonal. If it is the summertime, you have to listen to country music. You just have to, because it feels like summer. When it's not summer, my tastes vary much, much more. If I'm in the car, I'm actually usually probably listening to a podcast. But if it is music, then definitely country in the summer. Winter, it's a little bit more variable.
I am so glad that someone else finally feels the way I do about music, because I totally agree with that. Like
yes.
the vibes. It depends on what the vibes are like outside and how I'm feeling too.
Yep.
But yeah, Also a huge podcast person. You kind of answered this already, but what's better, the book or the movie?
Yeah, I wish I read books, and I just don't. And so if I've seen the movie's better because I probably haven't read the book.
Right. You can't be one of those people where it's like, the book was better. No, the movie's great because I haven't read the book. So
I can be blissfully ignorant and just enjoy the movie for what it is.
There you go. Next or dream travel destination?
So I feel like I'm at the age where I don't travel for leisure. I travel for everyone's weddings because everyone is getting married right now. Really, the only travel plans I have coming up are for people's weddings.
You're in that season of life right now. How many weddings have you been to this year?
This year, actually, we really only have fall weddings. We didn't have any this summer, but I think we have 3 this fall.
Gotcha, just a couple then, because I know some people it'll be like, we have like 7.
Oh, there was one summer, like summer fall time that we did have 7 in the span of like 3 months. It was every single weekend. Thankfully, none of them fell on the same weekend, so we were able to make it to everyone's wedding. We didn't have to turn down anyone, which we were like super, super grateful for.
Right. It's like, thanks everybody for structuring that out for us.
Absolutely.
Good deal. Well, it was nice to get to know you and kind of catch up with you, and then we're excited for Patience to meet you soon.
Sounds good. Thank you.
Thank you.